they're doing hours and hours of stuff. And so they're expecting your work to get them back as quickly as possible. But if you don't do the extra stuff, I always tell them the PT and the recovery stuff, that's actually way more important than even the surgery, right? Because there's so many different things ways you can fix it, right? It doesn't really mean they're not all perfect and they're not all the best, but the other stuff is important.
Basically when these patients are coming in, they're already at a disadvantage because they took a hit. And what happens to the patients after an ACL injury or any kind of injury, actually, the muscle starts to change its physiology. It becomes kind of resistant to growth, and there's both like neurological and physiological changes. So, I have this philosophy of the surgical athlete. So I treat all my patients like an athlete training for an event, and that event is their surgery. So I tell them, look, we got to prep you up for this. We got to get you ready. So all my ACLs get prehab, they get BFR. I get them into exercising before the surgery. I check their nutritional status before surgery. We do all these things to prime them up.
Reza, how are you checking their, sorry, interrupt. How are you checking their nutritional status? What are you doing?
So albumin is albumin and pre-albumin are good ones to check, and we can get into that a little bit more. That really ends up being a factor in the elderly group, but it's interesting. You'll also pick it up in younger patients, especially revisions, infections, and I'm in California, so I'm getting a lot of these vegetarians and vegans. And don't get me wrong, I'm vegetarian myself, except when I'm eating steak, But the reality is these patients don't heal the same way. They just don't, because they're not getting the substrates. And so when you check these variables, you're actually better off holding off on surgery for a little bit, optimizing them, getting them ready. So when they enter the operating room, they have all the necessary variables besides just the implant that we do in order to get them to heal faster. So kind of what this graph is showing here is that this decrease in mobilization is a problem because they have muscle loss. And so if you can kind of mitigate that by improving prehab, you build their resilience. And this is where we'll talk about where nutrition comes in to also improve their muscle resilience. So this hit that they take, everybody gets this. By the way, this is the best case scenario, guys. This is the healthy athlete. You get someone who's doing a joint arthroplasty, that line is much lower, much further down. Mm-hmm. And then the one with the hip fracture, 30% die in a year. So we have a lot of work to do in this kind of opportune time where the body's really breaking down its own tissue. And this is where, the strategies through, nutrition and amino acids come in to really effectively mitigate that drop that you see right there.
I see a lot more of this too. I do a lot of meniscus cartilage transplants. So these patients are like struggling. And the cartilage patients, they're struggling for like a year, 2 years, 3 years.
Yes.
So then they do their surgery. And the problem you have is like, I have patients today, they're 9 months out. They have no pain, but they're still feeling like their patella's not tracking right or something because their quad's been shut down for like 10 years.
Before surgery, and then after surgery, and then the amount of atrophy that we see in the quadriceps is really profound. And if you look at, we let most of our athletes, they want to get back by a year. Sometimes they're pushing to get back even earlier. But if you really critically look at the literature on ACLs, for example, at 1 year, not many patients are at 100%. Actually, most are about 75% other contralateral side.